So with AI transcriptions and AI kind of being quite a big buzz, a few people have asked just to demonstrate how that currently works in Goodx and kind of the concept behind it. I think the first kind of concept to think about is that essentially the consultation, which can be an audio file, essentially becomes the core source for everything else. Essentially, a consultation is between you and a patient. You may transcribe things, you may add multiple audio sources, but then this becomes the audio or the file and where other things can be created from. And that's essentially what happens in practice. You see a patient, there's information that's documented, and everything else that we do is repackaging this information in another way. Whether it's a reply letter to the optometrist, it's this information, but put in a specific way. Thank you for the referral. This is the diagnosis. This is the plan, etc. If it's a workman's compensation report, again, it's pretty much the similar information. It's just repackaged in a different way in different fields. If there is a report to the employer, if the employer wants information, this is also, again, some information comes across there. Medical aid motivation is, again, it's the same information. This is what the patient's vision is. This is what their central macular thickness is. We want to do X, Y, and Z. And obviously the audio file can create the actual clinical record. So the idea is to have an audio file which is the data, and from there one can then generate the other administration that you would normally need to do yourself, but then that is generated by AI. So that's the concept. Just to show you how practically that works. I'm going to take a patient here, let's say Clark Kent, and I am not going to make any documentation. I'm just going to go straight to create a recording down here, and I'm just going to dictate. It can listen in on the consultation. You can talk afterwards. I'm just going to show you how that works. I'm going to dictate something quickly here. So patient presents with gradual loss of vision in both eyes over a 2-year period, and right-sided 3-month history of worsening distortion in the right eye. Also complains of foreign body sensation, and burning and tearing occasionally. On examination, external examination reveals meibomian gland dysfunction with capping of the meibomian glands. There's a decreased tear film breakup time of 7 seconds, and there are punctate epithelial erosions on the cornea. The cornea is otherwise clear. Anterior segments are formed and quiet bilaterally. There are bilateral cataracts noted, nuclear sclerosis +2, vitreous is clear. Posterior segments bilaterally on normal, besides the right side showing a marked macular pucker with the epiretinal membrane. This is confirmed on OCT scan. Left OCT is normal, while the right eye has a significant epiretinal membrane. Plan is to perform bilateral phaco and IOL, aiming for emmetropia. There is no astigmatism, so no toric or LRI are required. Right side will be combined with the epiretinal membrane peel. Patient to be started on topical lubrication and to come back in 10 days' time for repeat biometry to treat dry eye prior to lens measurements, and then to schedule surgery from then. So essentially that's an audio file. You can see that it's there, and it's now transcribed it quickly into text. One can add additional audio files. For example, if I now wanted to add that actually the left eye, we're going to do a multifocal lens, I can then click record and talk. The left side, we are planning to do a trifocal lens, geometric lens, and patient counseled about pros and cons of monofocals versus trifocals, halos, glares, and decreased contrast, etc. Patient is happy and understands the risks versus benefits and is happy to proceed. So that's a second audio file. So there you can see a second audio file, and there it's transcribing it. So now it'll use this. This is that central source, which is the audio file in the center. And from there we can generate different things. So there's different approaches, and I'm still working out what's kind of working best. I started off with a plain eye evaluation form, which most people are familiar with, and that's probably the easiest way to start with it. Under external examination, obviously you've got your normal way of marking things. You can make it normal, you can click blepharospasm or hemifacial spasm or chalazion or whatever you want to click there. So you can document normally, but there's a section at the top here where there's just like an area for notes, and this is where the AI can put in notes for the eye exam. The same for the anterior segment there, so you can choose to use the AI or use the form as normal. So I'm just going to show you what that looks like. I'm just going to clear this, and let me just reset this. Okay, I'm going to reset that section, and now I'm just going to ask it to generate. I've got the prompt in there. I'm telling it which of these I want to include, and then I'm just going to hit generate for just to let it generate those. Okay, so then it's generated there. So if I look at external examination, I've got my Bowman gland dysfunction. Under anterior segment, I've got they formed and quiet, cataract, nuclear sclerosis. For posterior segments, I've got vitreous clear, marked macular pucker with the epiretinal membrane, vitreous clear, posterior segments normal. Special investigations, I've got OCT confirms epiretinal membrane. Surgery planning, it says bilateral phacoemulsification with IOL implant, ODB to be combined with epiretinal membrane peeling, aiming for emmetropia bilaterally, trifocal IOL plan for OS, no astigmatic correction required. And then assessment, it's given me, it's split out the right eye and the left eye. Right eye worsening distortion, meibomian gland dysfunction, dry eye, cataract, epiretinal membrane, and then the left eye. And then it's got the plan here is to repeat biometry in 10 days, bilateral phaco and IOL, patient counsel pros and cons of trifocal versus monofocal lenses, follow up in 10 days, and to return in 10 days. So that's one approach. The other way, which I've been using it as well, is just actually not having, not using it to do the clinical science. So one can just do, you can make your notes as normal as you would normally click and add, whatever your findings you wanted. But then allow it to just do the assessment plan. So you could click through your normal findings like that, and then let me just make a few more, and then just allow it to generate. Let me just unselect that one. That's the other form. And now it's going to generate again a section for this one. Okay, there we go. And so over here, so it's got the assessment and the plan, pretty similar to what we had before, but it hasn't changed any of the notes here. This is the notes that have been made. And then the last approach, which, this is all going to be a personal preference on how one wants to do this, is a really stripped down form. So this form actually doesn't have all the other subsections. It's essentially got your eye vitals, which, you normally can fill. I'm sure most of you are aware that you can pull in your autorefraction values straight from your autorefractor. There it puts in the VA, there it puts in autorefraction, the keratometry. So that works as normal. But and your history section, if you've got technicians or ophthalmic assistants that are helping with your history, they'll take the history there. But then your examination, special investigations, assessment plan, this has removed all the pills and sections and kind of made a very toned down version of the eval. And then one can use the AI to use your audio files to generate findings. And I'm still playing with the prompts here to try and get better or worse findings. If I click down here and down here, so you can see OD, it says external eyelid, meibomian gland dysfunction, capping of the glands, decreased tearful brachydplant to 7 seconds, punctured epithelial erosions, anterior segment cornea otherwise clears, anterior segment formed and quiet, bilateral cataracts noted, nuclear sclerosis +2, posterior segment vitreous clear, marked macular pucker with epiretinal membrane, left eye, etc. So it's kind of put the right eye findings and the left eye findings. It's put the special investigation findings. I just mentioned the OCT, and again, it's done an assessment and it's done a plan. You can read through that, but essentially it's start lubrication, biometry 10 days, phaco and IOL, right to be combined with ERMPL, left eye for trifocal lens, and that to return in 10 days. So those are different approaches of doing it. I can show you quickly basically what the AI is doing and where to set that up, because I think that's mostly what people want to know. They say, okay, well, I've got the version. How do I actually set this up? So I'm just going to go out of here, and I'll take you through to the where all the AI setup happens, because this. Okay, so I'm going to go, you might not have this at the top, but if you go to the top here and you go to configuration and you go to workflow event configuration. So this is where all your templates are. I'm going to find the iEval here. So I'm going to click on iEval 2. I've got a whole lot because I've edited and played with a whole lot. So let's take one. Let's, for example, take this one here. If I open it, if I double click on it, open it like this, you can see the different sections as normal. So this is how normally you would edit your iEval. And over here you can add section. If you go to toggle mode, you can add additional sections, you can add polls, you can add whatever you want here. So you can really customize your form to get it how you want. But this is not where you add the AI. So these all have, there is a text field here, but this is not where you tell it what needs to happen in the text field. So I'm just going to close that. If you click on here, you'll see Setup AI. So if you click on the template and you click Setup AI, this is what you'll get. So you'll be asked over here, what information do you want it to include when it's doing demographic data, appointment details, etc. And then you can tell it in the beginning when you create this, do you want it to automatically start generating? Do you want it to prompt you, or do you want it to skip? I normally set it to skip. I like to do everything, and then I like to click, okay, now I'm ready to generate. This is the main prompt. The main prompt is basically an overview. Okay, what's going on here? This is telling it, okay, you are going to hear a transcription between a doctor and a patient. Please you're going to make professional notes on this. Don't use colloquial language. Don't include anything. Don't hallucinate, etc. And then the different fields. So in this iEval, there's obviously a lot of fields, but any field that you have, like an introduction or an orbital section or whatever you do, you can enter that, and then you can tell it in that text field, I want you to do this, X, Y, and Z. For example, in the plan section, which I put here, I've just said here, generate short, concise action plan in bullet form. This needs to be concise but not miss any planned actions, which may include medication prescribed, procedures planned, referrals to other medical providers, and patients' instructions or counseling. So it will then, in the plan field, put whatever prompt you put in there. For surgery planning, for example, I've got a prompt there that says, place any surgical planning information here, what type of surgery, which side, type of anesthetic required if mentioned, cataract planning, what lens, where to aim, emmetropia, myopia, etc., if astigmatism, what surgical plan to be included, etc. So each of those text fields, you can say, in this text field, I want X and Y to be placed there. And so you can essentially build up a template depending on how you want it to be built up. And this goes for reports as well. So, for example, I'm just going to show you how that works. I mean, if I go to letters, where one gets reports, just click on letters for a second, and I've got an auto refraction letter, and you can see Setup AI. I've got a thing that says you will receive a clinical summary that has already been written. Do not generate or modify the clinical findings. This letter is being written to a healthcare professional. I'm referring this patient to an optometrist for X, Y, and Z. Okay, so a whole thing, and then I've got it told it what it must go in each field. And if I now go back, let me just go back to my diary, back to the original patient, and then I take one of these forms. Let's say anyone will do. I mean, all of them have the information in them. And then from here, I'm going to create a clinical letter, and I'm going to use that auto refraction template that I've just mentioned. It'll bring up the prompt. It'll ask me if I want to include this transcription, and I'll click generate. And then it will generate a preamble. It says, I'm referring Clark Kent, a 40-year-old male, to your care for an optometric evaluation. He presents with a 2-year history of gradual loss of vision in both eyes, 3 months history of worsening distortion on the right eye. The patient is scheduled for bilateral phaco with IO implant, with the right eye undergoing epiretinal membrane peel. The purpose of this referral is to obtain a refraction assessment and advice on refraction correction. Obviously, I wouldn't actually send this before I did the surgery, but it kind of just shows you kind of the idea behind the, once you've got the audio file, once you've got that central kind of information, you can then start to use that transcription to generate other reports from there. So that's the basic concept behind AI within Goodx. and how I'm starting to use it. I think a lot of the tricky part is just finding out what prompts work. What do you want in the different fields? How much detail, how little detail? And like always, you have to kind of tweak them until you get them right. So, but that's the basic concept behind it. I think it's very powerful, very useful. Just finding the right way to use it is really the part to get right now. But I think it's worth playing with. I think also importantly, if you don't see this little X here, this little blue X at the bottom, it's because you haven't set it up. So if it's not set up, it won't have the little green X there. Then you have to go up here, go to configuration, go to workflow event configuration, type an IEval here, and then once you have actually gone to any of your forms and click setup AI and set your AI up, then from there you will see that green X when you open any of templates that have that information. So I hope that was helpful. Good luck with fiddling and playing. But yeah, I think it definitely is going to make a huge impact on the practice. And I think more and more of these features are going to become part of our everyday life to hopefully streamline our workflow and give us more time with our family and more time with our patients and less time clicking and typing.